I'm with HeadQuarters, Kansas. My name's Meg Hasselman. I use she, her pronouns. And if you want to advance to the next slide, we will talk a little bit more about what HeadQuarters does. So we are currently the main 988 operator for the state of Kansas. So we answer calls, texts, and chat through the Suicide and Crisis Lifeline. We also operate a local crisis line through that 785 number that acts as dispatch for mobile response. And provides folks that don't have a Kansas area code the opportunity to connect with a local crisis line. Our services through the crisis line are free and confidential and available 24/7. We also provide in-person counseling services for folks that are experiencing a variety of mental health issues, including chronic suicidality and acute suicidality. We have recently in the fall opened a new line, which will be probably particularly of interest for you all. It is a youth-to-youth support line. So that line operates Thursday through Sunday, 4 p.m. to 7 p.m. So in the fall, we had a cohort of, I think, 8 youth who went through our training to learn supportive counseling skills and be able to provide just support for other youth who maybe need to connect with a young person. If somebody calls that line and they're experiencing a suicide or other crisis, they will hand the call off to an adult counselor. Our youth are trained in crisis intervention, but our preference is that adults be the ones that manage those crises in the moment. Great resource. After I am done speaking, because I'm not good at multitasking, I will put the number to that line in the chat. We also provide training and education at HeadQuarters. So we do a lot of stuff like this. We go into healthcare and behavioral healthcare settings, schools, other social service organizations to help folks improve their suicide care or approaches around suicide prevention and intervention. We also do some policy and advocacy work at the State House, advocating for policy and legislation that will improve suicide care across the state. And then we also partner with different groups and just kind of put out our own suicide prevention and public awareness campaigns as well. Next slide. So what Chrissy and I are really talking about today through the program that we'll fill you all in on is upstream prevention. For those who are not aware, upstream prevention is a strategy where you're not focusing so much on the intervention piece, you're establishing programs and supports before a crisis arises. So the earlier on in a youth's life that you can start implementing coping skills and protective factors, the better long-term outcomes are. So there's a story that we like to share about upstream prevention, and any folks that are experienced in prevention will have heard this story, so I apologize for the repeat information there. But I think it's helpful for folks who aren't as familiar with upstream prevention to kind of paint a picture of why upstream prevention is so important. So the story we like to share is that there was a village that was situated near a river, and that river led to a waterfall. And every morning there was one particular person who would go out and walk next to the river, just as a morning routine. And one morning this person was walking and they heard some shouting from the river, and they noticed that somebody was in the river struggling. And so they did what any of us would do, and they jumped in and pulled that person to safety. And so this person went back to the village and shared the news. I saved someone's life. This is so exciting. Everyone celebrated and rallied around that person. And then the next morning, they were out for their morning walk again, and the same thing happened. They heard some shouting. So they jump in, pull that person to safety. Right when they get to the land, they hear another shout. And so they jump back in and pull that person to safety. And they go back to the village and they say, this keeps happening. I don't know what's going on. And so they do all these things like train folks to be lifeguards, build a watchtower so that people can sit really tall and see if anyone's falling into the water. And they trained everyone in CPR, and they did put a lot of effort into this, and they saved a lot of lives, but they weren't able to save every life. And so one morning the person decided, you know what, I'm going to take a walk upstream and I'm going to see why people are falling into the water in the first place. So they walk upstream, they find that there was a gap in the fence, and so people were falling in there. And essentially, the story is demonstrating that if we put some services and programs in place early on, the better the outcomes tend to be long term. So the prevention strategy that Chrissy and I are talking about today fall under this upstream prevention umbrella. Next slide. So we are also talking about a shared risk and protective factor approach. I really like this quote from SAMHSA. Risk and protective factors are characteristics at the biological, psychological, family, community, or cultural level that is associated with higher or lower likelihood of problem outcomes. Go ahead and go to the next slide. So with shared, actually, if you could go back to the last slide, sorry, I got ahead of myself. So shared risk and protective factors between substance use and suicide tend to be pretty interconnected. So that means that things that increase risk for substance misuse also are things that increase risk for suicide. And the same goes for protective factors. Similar strategies that are used for preventing misuse of substances also are really effective in preventing suicides long term. Now we can go to the next slide. So this just really demonstrates the kind of crossover between substance use disorders and suicide. And so essentially what it's saying is that when somebody is experiencing a substance use disorder, their increased risk for suicide is very present, right? And folks who are thinking about suicide or at risk for suicide tend to engage in substance use, which can increase the likelihood that someone will attempt or die by suicide. So it's a pretty heavy crossover there. And when we implement strategies that address both of those risk factors, both of those health disparities, then we know that the effects are much more positive. Next slide. So HeadQuarters and DECA started to collaborate on prevention efforts. And this started through the Douglas County Public Health Plan. I believe this was I don't remember. Christy will probably know. I think 2017 or 2018 is when that plan initially came out. And it highlighted that suicide prevention and substance use prevention are two priorities in our county that need to be addressed. And so the county went to HeadQuarters and DECA and said, you all do suicide prevention and substance misuse prevention. So if you collaborate, right, then you'll be able to address some of those shared risk and protective factors. And so that is how DECA and HeadQuarters came to partner on this particular project. We have a long history of collaborating with DECA, but specifically for this program, that's how that came to be.